Welcome back. There's been a lot of focus lately on hantavirus and whether it could become the next major health threat. But from growing measles outbreaks here in the U.S. and now a new Ebola outbreak, it is now drawing international concern. Our next guest says that there are multiple public health risks that people need to be aware of right now.
All right, here to help break it all down for us, Professor of Epidemiology at UCLA Fielding School of Public Health and Director of the Center for Global Health Security, Dr. Rimoin. Thank you, Doc, for coming and talking to us. So much going on, so many different topics, whether it's Ebola or hantavirus, some other things we all need to be aware of. Let's start with hantavirus.
All right.
What is it? And can you talk about what's happening in America versus what is happening abroad?
Sure. Well, thanks for having me. There is a lot of news around infectious diseases right now. Hantavirus being the first thing on the list of things to be concerned about. Hantavirus is a rodent-borne disease. Hantavirus is actually a family of viruses, and there's several different actual viruses, strains of viruses that fall underneath that. What we have overseas is the Andes virus. That's a very specific one. Here in the United States, we have Rimoin virus. Most hantaviruses do not transmit person to person. Usually it's people sweeping up rodent droppings or urine or nests, and they get exposed because the dust is aerosolizing it, and then they get it. Andes virus, this virus that exists specifically in Argentina and Chile, it's the only hantavirus known to transmit person to person.
Oh.
It starts
and that's the one with the cruise ship, right?
Yep, that's the one with the cruise ship. And so it starts the same way. Somebody is exposed to rodents, and there have been a number of theories as to how the first people got it, but maybe cleaning out the camper that they were using, there might have been some rodent droppings in there. That's one of the hypotheses right now. The husband got it, then transmitted it to the wife. Then there were several cases that have occurred since that time. So it's very serious disease. It has very high case fatality rates. So it's unusual to see cases of it, but when you do, something to worry about.
I'm going to do a quick follow-up on that because I was under the impression, or we've been reporting, that it really doesn't spread human to human, but you're saying it depends on which virus we're talking about within the hantavirus family.
That's exactly right. So the hantavirus family, there are hantaviruses all over the world. And the only one that has documented person-to-person spread is this Andes virus that only occurs in this small part of the world. I mean, it's not a small part of the world, but a very specific part of the world, Argentina and Chile. And that is the only hantavirus where there's been any documented human-to-human spread.
And that's why people are freaking out, because this one can be. Okay, because
that's exactly right.
Because I was trying to make sense of it all, because they were like, don't worry, but yes, everyone's freaking out, and people are quarantining in Nebraska and all that. Now it makes more sense.
Right. And that's not to say that the hantavirus in the United States isn't dangerous, but that hantavirus, the one that we have here, does not have any indication that it spreads person to person.
So in terms of symptoms and in terms of when people should seek medical attention, what do people need to look for? When should they start to be concerned?
Well, so for the Andes virus, all the news about the cruise ships, everything that's been going on there, now that virus, if you've been exposed to somebody who's been on that ship, or somebody that has Andes virus, that's where you would worry. But for most people here, we're not. It's something that is contained as it is at present. Now, when we're talking about the Rimoin virus, the hantavirus that we have here, the one that Gene Hackman's wife died from, there's just another recent case in the news. There are only a few cases a year that we normally see. I think the average in California is 3. Doesn't mean it's not something we should be careful about, because the consequences are really high. So what I say to people is, if you're going to be sweeping out areas, airing out areas, you have a cabin in the woods that has these kind of deer mice that are the vector here, the reservoir here. I would make sure wear a mask when you do it, but also don't do it dry. You want to wet that down so it's not going to aerosolize up. and use bleach, and be very, very careful when you're cleaning out rodent droppings. That's what I would do.
So what are the treatments for the different types of viruses, and is there such a thing as a vaccine for hantavirus?
Well, there's no vaccine for hantavirus that is available for people or any of the hantaviruses. There is also no specific treatment. It's only supportive care. So the deal is if you get hantavirus, getting diagnosed and then treated as quickly as possible is the key here. And that's why they've been so concerned about the virus that's spreading on this ship, because the consequences, if it does spread person to person in that condition where they don't have rats on the ship, or if a person just gets it themselves here in the United States, they're very, very serious. So if you've had these kinds of rodent exposures and you do get sick, it's always worth mentioning to your clinician. It's something that is very unlikely to happen, but better to be safe than sorry.
Right.
So if I had that kind of exposure, that's what I would do.
For sure, and we're of course entering the summer travel season. I think I'll project, you hear ship, I don't have a ship cruise planned, but if I did, you're hearing so much of ships in the news and you do start to get concerned. Maybe it's not hantavirus, but you think, can I get something by being on a cruise ship? Do people need to be concerned, or is this something that is so rare that not necessarily?
Well, listen, cruise ships are the perfect place for an infectious disease to spread. Yeah. Now, I would say that hantavirus is not your top concern on a ship, and that is a very unlikely situation. I think this was just a very unfortunate confluence of events, and this virus infected people that had been traveling around South America. They ended up on this ship. It spread. So hantavirus, not top of the list. Norovirus, on the other hand, very, very top of the list here in terms of something that could affect you. In fact, right now, I believe there in the last couple of weeks, there have been at least two significant outbreaks on cruise ships. One in France, one somewhere with the I think it was a Royal Caribbean cruise or one of these other ones. I don't know where exactly it was, but so two different pretty significant outbreaks of norovirus, and you see those all the time. Other gastrointestinal things also easily spread. Same thing with respiratory viruses. I mean, it's a closed environment. People coming off and on ships, high touch surfaces that all these people are touching all the time. Buffets.
Chris
That's,
loves
I mean, well, you
buffets.
think about, but you just think about that, and people coming off and on ships, and so it's such an easy place to have these kinds of high touch surfaces. So if you're thinking like an epidemiologist, then you think, okay, well, maybe there are risks that I don't want to take, or when you go on a cruise or just eat at a buffet in general, I mean, I like a salad bar. I don't know if there's still salad bars, but anyway, a salad bar, I like that whole idea. But you just want to make sure if you're touching things, wash your hands very carefully. Don't, touch your face. Just pay attention to what kind of these high touch surfaces are, and be vigilant about it. It doesn't mean you can't go. Right. It just means be careful.
All right, from hantavirus to measles. Recently, an LAX resident returned through the Tom Bradley an LA resident returned through LAX through the Tom Bradley terminal. Turns out they had measles. What should people look out for? Because we get these, we report them. If you were, it's such a, we report it, and I always think to myself, how do you know? Like, if you were in the Tom Bradley terminal between 8 and 11 a.m. on the 30th of such and such, I mean, it's such a specific yet at the same time vague warning. Get yourself checked. Tell us about the risk of measles. Tell us how we can protect ourselves.
Well, measles is considered one of the most contagious viruses known to man.
Oh, wow.
I mean, it is extremely contagious. It's it's a respiratory virus. And in fact, it's so easily spread. It can hang out in the air for a long time, up to 2 hours. Like if one of us had measles and left the room, for approximately 2 hours, the virus could still be circulating. Wow. And it's such a contagious virus that if you are not immune to it, it's a very high probability of getting it if you come in contact with it. And so it's one of these infectious diseases are not all the same. It's not all, yes, this is not a problem. Yes, this is a disaster. There are lots of spaces in between. Measles also has a lot of very serious long-term effects, and one of the things about measles that's so kind of insidious, it's really a problem, is that it can wipe out your entire immune system. So all the immunity that you built up previously is dissipated, and so then that can be a real problem for it. And there are a lot of people, like young children are not vaccinated, and they can be very susceptible to it. There are lots of serious consequences to it. So measles, it's a problem when you see it, and that's why places where you've got a lot of people, like airports, become big places where you can see lots of spread.
So take it seriously, yeah. So let's move on to Ebola. The World Health Organization has declared a global health emergency over an outbreak specifically in Congo and Uganda. I know you've been working in that area for 25 years. Talk about this outbreak specifically and how it compares to some of the others.
Well, this is a very serious outbreak. And this is something, there are so many reasons that this is concerning. It's always concerning when you see an Ebola outbreak because the case fatality rates are so high. When you think like an epidemiologist, you think, well, how easily does it spread? And then how serious is the disease? Well, this is one that it's not respiratory, so it doesn't spread as easily. It's not on the category of something like measles. You have to have very close contact with fluids from somebody that is sick and to touch them. But it is so deadly and so dramatic. And the consequences of getting it, if you do survive, there are a lot of long-term consequences. So what I would say is the reason that this is so serious is that it is a very specific species of Ebola virus, the Bundibugyo species, and it is not, it's different enough from the other species of Ebola that we normally see that the diagnostics out there didn't work. So this outbreak started probably a little over a month ago, maybe even longer, in a remote area. It has a lot of mining, a lot of conflict, very poor health infrastructure, and the diagnostics they were using didn't pick it up because it's not the Ebola Zaire strain, which was responsible for the huge outbreak they had in West Africa and many of the other ones that we've seen. And so for a very long time this went on. So now there are multiple chains of transmission, cases that are in Uganda, DRC. Now we've seen a case in Goma, which is a big city in eastern DRC. We've seen 2 cases in Kampala, which is a big city in Uganda. We see that maybe some Americans have been exposed that work in a missionary hospital. Makes sense, people get sick, they come to a hospital, looks like any other malaria or anything else in the region, then they start treating it. So we've got that problem. It's also something that, treatments for this particular species don't exist. Vaccines don't exist. And so it's a real problem for the region.
Scary.
Yeah. Wish we had more time. Wanted to talk to you about preparedness with the World Cup, but we got to go. Means you got to come back.
I'm all in. Just let me know when.
Thank you, Dr. Anne Rimoin, Professor of Epidemiology at the UCLA Fielding School of Public Health and the Director for the Center for Global Health Security. You can follow her on X or on all social media, on Instagram, @Anne Rimoin. Thank you again, Doctor. We appreciate it.